I'm very happy to see you all from so much different department. So I'm given the responsibility of speaking on introduction to research methodology in oncology. So I think this is the most basic of today. So I'm the Oncology Catalyst Fellow 2025, and you can contact me at my Gmail or contact me at my X, formerly called, I still like to call it Twitter, but next. So that's the problem most of us have. Research is very important, but I don't know where to start. So the objective of the presentation, so we'll be talking on the basic of research. So we'll define research, so why research is so important in oncology, how to proceed with research, what are the types of research, and how to basically write research proposal and translating research into clinical impact. Next. So by definition, if you see, what is research? So research is a systematic investigation into a study of materials and sources in order to establish facts and reach new conclusions. That's actually the definition of research. But if you just read it, it's very heavy words. It doesn't mean it doesn't strike your head. So let's look closer. So it contains the word systematic. So it means that it follows a structured process. So there is no random guesses. So there's another word, investigation. So how do you investigate? We involve careful study and analysis. Then there is material and sources. So for material and sources, we need data. So data can come from patients, lab results, literatures, surveys, etc. So what are we trying to do with the research? So we are trying to establish the facts. So we need we either prove or disapprove something scientifically. That's called hypothesis. Now, new conclusion. So any research had to add something to existing knowledge. Otherwise, that research won't mean anything. Next. So this is a very paper published in one of our journals in Nepal. So analysis of the cases of carcinoma gallbladder in a tertiary level hospital. So there's the introduction where gallbladder cancer is a rare disease in some part of the world, but it's common in countries like ours. There is a method described a retrospective analysis of consecutive operated non-admitted cases of gallbladder in TUTS from 2018 to 19. Patient demographic, disease characteristic, diagnostic modalities, and various curative and palliative treatment variables were analyzed. So result of the 59 patients, 33 were females, 26 were male. The median age was 56 years. Presenting system most present was abdominal pain, and USC and CD lead to preoperative diagnosis in 100% of cases. Curative resection was done in 27% of cases. So the conclusion the author gave was carcinoma GB is more common in Nepal, more among females, often presenting with pain, abdomen, and jaundice. Most are advanced at the time of diagnosis. Radical surgery can be offered to few patients where the outcomes. So, do you think it is considered as a research? So those you think it is a research, please raise your hand. Those you think this should not be considered as research, please raise your hand. Next. So if you go on and see the definition of research. So is there a systematic investigation? Yes, the author systematically reviewed medical record of patient from 2018 to 2019. So is there defined material and sources? Yes, data were drawn from hospital records of admitted, operated, and non-operated cases, including demographics, diagnosis, and treatment details. So was there objective and structured approach? Yes, there was a study design, it was a retrospective analysis. Population was defined, patient who come to hospital and fixed time window, and the variables were defined like gender, age, symptoms, imaging use, site of disease, metastasis, treatment, and survival. So was there findings and new conclusion? Yes, gallbladder is more common in Nepal than in other part of the world. Females are disproportionately affected, must present late with only 27% resection rate. And this observation can inform local clinical practice and future prospective research. So if you see that research actually fulfill all the criteria of research. So whenever we think of research, we always think big phase 3 randomized trial, but research can be very small. So, but it should fulfill the criteria of research. Actually, this was very important research because it was one of the earlier paper which shows that gallbladder cancer was very common in Nepal. So actually, it filled a huge gap. So initially you may seem that, oh, the research is very basic, it is not that, but actually it's very important research in our context. So what I'm trying to say is, research doesn't mean it should always be big, heavily funded, phase 3 randomized. It can be something basic. So, so as sir in previous talk said, that research can be done anywhere, any place, without much funding, but with some efforts. Next. So why research in oncology matters? If you see, the most research currently is going is in oncology. Why? Because oncology is now becoming an epidemic. So if you see number of new cases, this is 2022 data from GloboCan, 19.9 million number of new cases. Number of deaths, 9.7 million. Number of prevalent cases, that's patients surviving diagnosed last 5 years, is 53 million. So if you think number of family affected, it would be around 200 million. So it's a huge global burden. That's why it's very important. Next. And also, cancer is a complex, rapidly evolving disease. Because if you compare with other diseases like hypertension, so hypertension, you diagnose, you know the etiology. So much of the research in hypertension is now going on the treatment part. There is much not research in the how it is causes. So, but cancer is complex and rapidly evolving disease. So we need new drugs, biomarkers, and treatment to tackle it. For that, we need research, we need to generate evidence, and evidence helps us to get personalized care. And what is our main target? To improve survival, quality of life, and systems of care. That's why it's so important. Next. So we always see, especially in research paper, in even in magazine, that there is always a new drug that has come, that a magical bullet. But if you see, and if you see the data, for every 10,000 compounds which has been identified initially in lab, one compound actually makes it to market. So when the initial discovery, there are 10,000 compounds. So on a 250 goes into preclinical testing, 5 goes into phase 1 trial, 2 into phase 3 trial, and only 1 is phase 3 trial. So yes, there is a new drug in market, but look at the amount of research that's going behind it. So there are 9,999 compounds which have been rejected, then only we have 1 compound which actually acts. Next. So is the research working? So if you see this graph, this is the global cancer mortality to incidence ratio for last 10 years. So we don't go back very much back, so we'll go last 10 years. So if you see in 2013, for every 100 patient diagnosis or incidence, there were around 58% mortality. So now coming to 2022, that's 10, so for every 100 patient, there is 50% mortality. So mortality has come down, and it's all due to research, innovation, and all this effort and hard work. So it's working. It's not that it's working, but yes, we want magic. We all like magic. As a children, what we want is magic. Someone pulling out a pigeon out of hat, but there is no magic in real life. So we have to do it hard way by doing research, innovation, and it's actually working, because in last 10 years, cancer mortality to incidence ratio has come down from 58 to 50%. Next. So research is like that big burger. You know, everyone likes it, but very few know where to start, and very few know how to finish. So next. So we should have a structured process when thinking of research. So what is that structure? There are many ways to define it, but I think this was the most easier version. So first thing is identify a problem, because in research what you want to do is you want to solve a problem. It may be small, it may be big, but you want to solve a problem. For problem solving, you need to identify a problem. Second, you need to review a literature. Third, now you know what's the problem, what has been done, then you need to frame a research question. Then, okay, I want to ask this question, I want to do research in this thing, so you need to choose designs and methods. Then when you design a method, then you actually go do research and collect and analyze data, and finally interpret and disseminate finding. So how to identify a problem? Next. So whenever we say problem, we can't say problem individually, but we always have to see problem in population and context. Next. So we always need to choose a population who is affected by the problem must. So when you see many problems are similar worldwide, like if you see in cancer, breast cancer, brain tumor are similar worldwide. But many problems are specific to our population. That's why we need to merge the population and problem. So if you see financial toxicity, he has done intensive in 8. So yes, this is very problem unique to our population. Resource limitation, how to work in resource limitation. So there are few cancers like locally advanced gallbladder cancers, locally advanced cervical cancers, head and neck cancer. These are very problem specific to us. So why it is important? Because if you want a paper of a breast cancer, you will get many paper. You don't need to work on it more. But if you want a paper on gallbladder or locally advanced cervical cancer, you will not get it because it's our problem. So we need to tackle it. Next. So now problem and population is defined, but if you don't see the context, sometimes we can make a huge mistake. So it is very important to know the local context. So it's always ideal to involve the local researchers because they know the context. Next. So if I say you look at your neck before eating bone, so most of you doesn't strike anything. Oh, it's a random scrabbling. But if I say ghati heri garden, now you know everything what I want to say. That's the context, that's the local context what I mean to say. So for example, these were the paper published in 2008 which made a huge splash. So it was a head and neck cancer where platinum-based chemotherapy was combined with cetuximab. So if you see the problem and population, head and neck cancer is our problem. We see a lot of head and neck cancers. We have treated more than 2,000 head and neck cancer and more than 200 recurrent or metastatic head and neck cancer. So if you see problem in population, you see, oh, this paper is ideal for Nepal. But if you see the context, cetuximab is very expensive medicine. So we have treated more than 250 metastatic head and neck cancer, but we have hardly given cetuximab to 2 patients. So problem and population is okay, but it is out of context. So knowing context is very important. Next. So let's see another paper. It's a low cost, this is also in head and neck cancer where oral metronomic chemotherapy was given versus intravenous cisplatin. So this was paper published in 2020. Worldwide, this paper doesn't make big sense because it was not compared to standard chemotherapy. But for our context, this paper was life-saving because at that time we didn't have any thing to give to patients. So we actually treated around 100 patients with this regimen. So context is such an important part. Next. Now coming to review literature. So why we need to review literature? Next. So to know what is already known, what is there to be known, and bridge this knowledge gap, and it also help us to avoid duplications, and it helps also build on previous findings. So research is like a stepping stone. So if we know the first step, then we can put on another step. So there is no hard and fast rule how to do review of literature, but how I do it is, if you want to identify any problem, if you want to do research, what I usually do is I search the latest review articles in the subject, read the few review articles about the subject. Then after reading few review articles, I know what are the main trials which actually guide our current treatment regimen, because this trial will be repeated in every review articles. I read those trials in details and find the ongoing trials on the subject. So it's how I do it. It's not the standard. Many people have different way to do it, but I think this is one of the easier way. Next. So why review of literature is so important? So I will give an example. This was the trial we started in 2021 So safety and efficacy of modified FOLFIRINOX. So FOLFIRINOX is a chemotherapy regimen given mainly for pancreatic cancer. It was published in 2018. So at that time there was no standard regimen for biliary tract cancer. So we thought if it works in pancreas, it should work in biliary tract cancer. We reviewed the literature, there was no data, so we thought, oh, we can do it. So we designed a phase 2 single arm. We got an ethical approval. So we calculated the numbers, 19 patients. We ethical approval in March 2021 and started enrolling patients. And we enrolled 3 patients. Next. But in October 18, 2021, this paper was published. So this paper compared FOLFIRINOX with cisgem. It was and it was a randomized 191 patients, modified FOLFIRINOX, what we are trying to do, and there was no advantage of FOLFIRINOX. Now, when this paper was published, do you think our paper mean anything? No, because it was bigger, it was randomized. So now, if even we publish our paper, it won't add anything. Right? So we dropped the idea. We Subhash and me discussed about it, and we stopped our trial. So what we learned from our mistake is that, one, yes, we reviewed all the literature, but we did not review what was going on. So we reviewed the literature. So while literature review, it's important to review what's published, and also it's important to review what's going in near future also. So I think we made our mistakes. Another thing, it's important to review literature not only on the initial part, but also we need to review every time, so that we need to see what's added on the knowledge. So now coming to very important part of process, framing a research question. So how do you frame a research question? So there are many ways. So FINER criteria is most commonly used. So what is FINER is basically an acronym for feasible, interesting, noble, ethical, and relevant. So whenever you are framing a research question, the research question should answer this thing. Is it feasible? Is it interesting? Is it noble? Is it ethical? And is it relevant? So there is another format which we'll talk later. Next. So feasible. When we say feasible, feasible for what? So is it feasible for subjects or patients? Right. So do we have enough subjects? We can't plan a big randomized trial on a rare cancers because the subject would not be feasible. We do not have accurate. So is it feasible by money? So whenever we do research, for research we need money. So will we get fund? Will we can do it by ourselves, or what we call investigator initiated trials? Will it be feasible by time? So just like our resident, they have limited time, 3 years. So you can't start a research which needs to complete by 5 years. So, right? So it's not feasible by time. So we also need to see, is it feasible by time? Is it feasible by resources? Resources, it can be human resource, it can be mechanical resource. So if you see, even the well-planned research, so this is the paper published in 2019. So even all the trials that are registered in clinicaltrials.gov, 20% of the trial has poor accrual. So we should say this research were not feasible by subjects or patients. So even the well-planned trials face poor accrual. So which of the trials, so they get the data that which of the trial faced poor accrual. So if you see by sponsor type, industrial trial has best accrual compared to institutional, national, or externally peer reviewed. So if you see by phase trial phase, so phase 1 has best accrual and phase 3 has poorest accrual. Next. So for that, even we may do all the hard work, we may do all the review of literature. Sometimes actually as a researcher, we don't know. So we wanted to start a trial, but we don't know, because in our context, is it feasible or not? For that, there is something called feasibility study, right? And there's something called pilot study. Sometimes we get confused with feasibility and pilot study. So feasibility study is the study to determine whether a study can be done. So it mainly checks logistics recruitment and time and resources. Whereas pilot study is a small scale version of the main trial. So it tests process, data collection, tool and protocol. So pilot study is actually the full study, but in a small number. They are not powered enough to see the difference. So feasibility study can be considered part of the clinical trial pipeline, but not designed to test efficacy. Whereas pilot study is a type of small clinical trial, usually phase 0 or pre-phase 1. So the purpose of feasibility study is to answer, should we proceed with the full trial? Whereas the purpose of the pilot study is, can the full trial work as planned? So there's slightly difference. So it's to know actually it's feasible or not. Next. So we wanted to, I will give our own example. We wanted to establish a biobank in our hospital. So we did all the research. We went to every biobank facility in Nepal. But even after doing that, we were not sure if we can start, because there was no biobank facility in Nepal in a hospital setting. So we are trying to, as we see in the final criteria, it should be novel. But sometimes doing novel, you don't know if it works or not. So what we decided that, okay, what if we biobank a sample and after 1 year, the sample is not viable? So all the hard work is gone. So we plan a study where we will be taking the feasibility testing to establish a cancer biobank in KCC. So what we are trying to do is, we'll keep the sample, and after 6 months we'll see how much is viable. So we are not planning anything from that sample. We just want to do if it's possible in our setup, because it involves many manpower. There are many power breakage. So we need to see all this in context. Next. So similarly, this was a pilot study led by Dr. Sunil. So it was a clinical pharmacist intervention on pain management in cancer patient in low resource setting. So such a trial was never done in low resource setting. So before going into big phase 3 clinical trial, we want to know if it works in our setup. So it was a pilot study. It was feasibility and pilot study. Next. So we all know it should be interesting. So there is a journal. First, what you do, we read it, the topic, and what we feel interesting, then only we read it. So it should be interesting. So it's important to you and your community. So will it spark curiosity and engagement? That's also very important. Next. So it should be novel. As I said, does it add new information? Does it confirm previous findings? Or does it refute current understanding? So these are the questions we should answer before starting any research. Next. And very importantly, can it be done ethically? So are the subject safety and concern addressed? Next. So at the end, will the finding impact clinical practice and future research? So is it relevant to our to us? Next. So there are many conferences going on around, especially in cancer. So we see this best of ESCO, best of ESMO, where few research are selected and presented. So what do you think decides how this are selected? Yes, this should be interesting, this should be novel, and this should be relevant. So these are the articles which are actually selected and presented everywhere. Next. So this is an example. It's top 5 ASCO 2025 must discuss clinical trial. ASCO has just completed. So if you see, these are the 5 trials. Next. So number 1 is structured exercise after adjuvant chemotherapy for colon cancer. If you see, it's interesting, relevant, and novel, right? Second, incorporating cetuximab and modified 𝗦𝗶𝗺 in BRAF mutated colorectal cancer. Third is first line camizestrant for emerging ESR1 mutated advanced breast cancer. Fourth is overall survival with inavolisib in PIK3CA mutated advanced. So this is interesting. These are novel, but these are not relevant to us because these drugs are not available. Right. So if you see last, the overall survival with neoadjuvant nivolumab plus chemotherapy in lung cancer. This very interesting. It's very relevant, but it's not novel because similar studies have already been published, especially in last phase 3 trials. So it should be interesting, novel, and relevant to get all the hype, to get actually something to population. Next. So another way of forming a cancer is PICO method, where P is patient population or problem, I is intervention or exposure, C is comparison, and O is outcome. So in P, it's what are the characteristics of patient or population. I is what do you want to do with the patient. C is what is the alternative to intervention. Now, O is what are the relevant outcomes. So sometimes we get confused that which should we go with, finer criteria or PICO. Next. But there is difference. So the purpose of the finer method is to evaluate the quality and viability of a research question, where PICO is to formulate and structure a clinical research question. So initially you go by finer method, and once you think, okay, this study is viable and to our population, then you go by PICO method to formulate and structure clinical research question. So finer is used when especially brainstorming or screening a research idea, whereas PICO is done when designing clinical trial, systematic reviews or interventions. Finer asks the question, is it worth doing? Whereas PICO asks the question, how will I study it? So there is some overlap, but usually we start with finer and then go to PICO. So type of research is in finer, we can do it for every type of research. PICO is mostly for quantitative clinical research. Next. Now coming to design and method. Next. So cancer research can be basically divided into epidemiological studies, which can be either observational or analytical. Experimental research methodology, it can be in vitro or in vivo, and clinical trial, it can be phase 1, phase 2, and phase 3. Dr. Subhash will be talking more on it, so I won't be going in detail of it. Next. Now collect and analyze data and interpret and disseminate. So we have a separate class on it, so I won't be going on it. So this is how research process is done. Now about some part of types of research. So it can be quantitative, qualitative, or mixed method. Next. So in quantitative research, we do objective measurement and statistically analyze it. Usually has large sample size and structured method, and common in clinical trials. Next. So study design is usually RCT, cohort studies, or case control studies. It can be cross-sectional or longitudinal. Data collection is usually done by surveys, lab visual, imaging data, and electronic health records. And we use structured and standardized tools. So stats, we usually mean, median, mode, p-values, confidence interval, regression, correlation. Next. In qualitative, however, what we want to say is we understand human experiences. So quantitative is more about numbers. So qualitative is no more about feelings. So it usually has rich contextual insights and small and purposive samples. Next. So study design are usually, because we want to know the feeling, so it's usually in-depth interviews, focus groups, and observation and field notes. Data collection is by thematic analysis, coding and categorization, and other tools. This will be discussed in our next classes, so I won't be going in detail. So most of the research, especially in oncology, are mixed method. So they want to know the number, and they also want to know the quality of life. So it combines qualitative and quantitative, and it offers comprehensive understanding. Example, patient-reported outcomes plus survival data. Now we see many of this paper which have patient-reported survival data plus quality of life. So quantitative is you can use in every type of research. There is statistical rigor, so we can say, okay, this is the number, this is the result, so we can say we strongly accept or refute any hypothesis. Qualitative, meanwhile, is human-centered depth. So actually there is no scale to measure it. There are some scales like your RTC, quality of life tools, but they are not based on numbers, so they are not rigorous. So mixed is the holistic view. So if you see weakness of each method, quantitative have limited context, and qualitative usually have small sample and subjective. And mixed, everyone wants to do mixed, but it's usually resource intensive. So now we know how to plan a research. Now we have to write it, because without writing, it doesn't make sense. So what are the key elements of research proposal? So we all know by now it's background and rationale, objectives and hypothesis, and methodology and timeline. Next. So what does background and rationale contains? It usually contains why this study is needed. So it includes overview of disease of the topic, local plus global context, existing knowledge and key gaps from literature review, local relevance, especially for countries like Nepal. We have talked in detail in that. Now, how this research will add value or solve a problem. So this thing should all be included in background or rationale. Now, aims and objectives. Sometimes we use it, mix it but there is a difference between aims and objectives. So aims is the broad general goal of the research, whereas objectives is specific measurable steps to achieve the aim. So focus is what you want to achieve overall in aims, but objectives, how will you achieve it? So aims are usually very limited, it's usually 1 or 2, whereas objectives, it can be multiple, and it can be primary or secondary, where primary is the main objective and secondary are the add-on. So nature, aims are usually abstract and strategic. So I want to do this, but objectives, they are concrete and actionable. So next. So suppose this is a research we are planning, evaluation of treatment outcomes in young patients with cervical cancer in Nepal. So aim is to evaluate the treatment outcome and associated factor in cervical cancer. This is just an example. Patient aged below 45 years in tertiary cancer. So aim is, you see, it's very broad. But objectives, how do we want to achieve our aim? So it can be primary or secondary. Primary is our main objectives. So how do we want to see? So to determine the 5-year survivals and progression-free survival among young patients. That's objective. Secondary, to analyze the pattern of disease, to analyze treatment-related toxicities, to identify prognostic factor. So this is how aims and objectives are divided. Next. So whenever we want to research, we want to test a hypothesis. So what is a hypothesis? Hypothesis is a specific testable prediction about what you expect to happen in your study. It's often framed at 2 opposing possibilities. So whenever we start a research, we have in our mind what we want to test. So there is always a null hypothesis that anything we do doesn't act. So there is no effect, no difference, or no association. It's the default or starting assumption. So whenever we start, we always start with null hypothesis. So research often tries to test it and reject it. So alternative hypothesis is that there is an effect, difference, or association exists. So if evidence from our data contradicts the null hypothesis, we may accept the alternative. Next. So methodology and timeline, in that we have to have a study design, which can be observational, experimental, RCTs, case control. So we'll talk in detail in the next class. Population and sampling. So we need to define the study population. We need to define the sampling method. We need to define the sample size, inclusion and exclusion criteria, data collection method. So how we are going to collect the data? It's surveys, interviews, records, imaging. So what tools are we going to use to collect the data? So we need to define everything in our research proposal. Next. So variable, and what are the variables we want to see? It's dependent or independent variables. So, and how the variables will be measured. So how are we planning to analyze our data? And ethical consideration, we have informed consent. Is the consent in local language, English? So we need to define everything in our research proposal. IRB ethical approval taken or not taken, how the confidentiality and data protection maintained. So we need to define everything. Next. So now we can plan a research, we can write a proposal, but very important thing is to develop a research timeline, because there is nothing called timeless research. You need to have a specific endpoint. So why 5-year survival is usually used in cancer? Because this is the so it's not that in 5 years everything goes smooth and patient is cured, but we need to have a specific timeline to end the research. So in cancer, it was found that 5 year was the right balance. So it's mostly used in cancer. So what a timeline shows is this planned duration for each step of the project. It helps ensure feasibility and track progress. So it's usually done by Gantt chart approach. So Gantt chart is a visual project management tool that shows a timeline of research activities, helping you plan, track, and communicate the process of the subject. Next. So this is the Gantt chart. So if I say by definition, it's very hard to understand, but everyone must have seen this chart by now. So next, previous one. So here in Gantt chart, we give the timeline and what we want to achieve in that timeline. So for planning, for research, design, implementation, follow-up. So we have timeline for everything. So it helps us to progress our research. Next. So now coming to our last slide. So how this research impact clinically? So our aim is to, as we say, to improve the patient clinically, to have real impact on the patient. So it says that research that doesn't reach the patient is only half done. So you may have done a beautiful research, but if it doesn't impact the subjects or the patients, it doesn't mean anything. So what are the when we do a research paper, our aim is that it is incorporated in national or international guideline. So if we are doing a clinical trial, our aim is to add something into new treatment standard. If we are doing something new biomarkers, so our aim is to get it incorporated into routine clinical test. And if we are doing a feasibility study, so we want it to be included in national screening or care model or do full plan. Thank you. Thank you all.